Hi, this is Dr. Abdul, Physiotherapist. Welcome to my channel. Let's talk about heart attack in this video. Heart attack, medically known as myocardial infarction, is a deadly medical emergency, and it may be severe enough to cause permanent heart damage or death if not taken immediate medical help. And sometimes it may be silent heart attack, medically known as silent myocardial infarction. It's called silent because it shows mild symptoms or none at all and generally discovered only during routine investigations. For more than 1 million people experience a heart attack every year, and the number is increasing day by day. And in that, a silent heart attack counts for about 45% of heart attacks and strike men more than women. What is heart attack? Our heart muscle needs a constant supply of oxygen-rich blood for its proper functioning. Coronary arteries give this blood supply to heart. As you can see in the diagrams, these are coronary arteries. And if these coronary arteries got affected, that is in CAD, then you experience heart attack. What is CAD or CAD? Before I explain CAD, let us explore the normal coronary artery. This is how a normal coronary artery looks like in a diagrammatic representation, with a clear lumen internal space without any blockage, and a good blood flow is established. So a coronary artery disease is the common cause of heart attack, and it comprises of about 95% of total heart attacks. Let's see how it looks like. So here in the first picture you can see the artery, coronary artery, is blocked partially by the plaque, and you can see the blood flow is affected. Minimal blood flow is happening on the other side. In second picture you can see how the coronary artery is completely blocked with the clot and the plaque, and 5% comprise of when blood supply to your heart is blocked due to some other reason other than coronary artery disease, one among which is muscle spasm. As shown in the picture, the muscle cell, smooth muscle cell of the coronary artery, when it gets spasm, it will constrict the coronary artery and affect the blood supply. And further, among the 5%, the heart attack may occur due to the rare medical conditions that causes unusual narrowing of blood vessel. It can be due to trauma that includes tears or rupture of coronary artery, or maybe due to direct hit or blow on the chest, or in a road traffic accident. It can be due to obstruction that came from elsewhere in the body, a blood clot, or maybe an air bubble. We call it as embolism in medical language. That gets trapped in a coronary artery. Then you get a heart attack. Electrolyte imbalances. Having too much or too little of key minerals like potassium in your blood can cause a heart attack. Eating disorders. Over a period of time, an eating disorder can also cause damage to your heart and ultimately result in heart attack. Let's understand more about coronary artery disease. There will be a blockage in coronary artery by a plaque. Understand the plaque like similar to how pouring grease down your kitchen sink can clog your home plumbing, just like that. So when plaque break open or rupture, it can cause a building up of clot, and this clot reduces the amount of blood flow to your heart muscle, thereby causing heart attack. In a diagrammatic representation, we'll see a healthy heart, how healthy its muscles and having a healthy coronary arteries. Whereas compared to the unhealthy heart, you can see here in a diagrammatic representation, this artery which is marked over here, let's suppose say it is affected by coronary artery disease, and if you see a cut section, a microscopic view, let's say it has both plaque and also a clot which has completely blocked the artery. Imagine the artery supplying to this part of the heart is badly affected. The muscle tissue of this part of the heart will gonna die or will be permanently damaged if the blood supply is not restored here. And that's how the heart attack occurs, and if it is not restored, the permanent damage of the tissue of the heart will leads to the heart failure in future. What you may undergo in heart attack. Number one is chest pain, and it is very characteristic. You feel like a pressure on your chest, tightness and a squeezing pain. Squeezing pain in the chest is very characteristic of heart attack. Pain or discomfort that spreads to the shoulder, arm, back, neck, jaw, teeth or sometimes the upper belly. Cold sweat is a very characteristic of heart attack. Shortness of breath or trouble breathing. Heart palpitation, abnormal rhythm and heavy pounding of heart. Nausea or stomach discomfort is common, and heart attack can often be mistaken for indigestion, but it's not. Feeling lightheaded, dizzy or passing out. Kind of a blackout is what another symptoms characteristic of heart attack. How to confirm if it was a heart attack? Number one is ECG test, that is electrocardiography. If this does not give a proper result, then go for a blood test to measure the level of serum marker. The presence of this marker shows that there has been damage to or death of the heart muscle tissue. Troponin T is a serum marker which is produced by the heart muscle tissue and will be released and seen in the blood supply only when there is a damage to the heart muscle tissue. Echocardiography. If the above tests do not give enough information, then go for the echocardiography. And one more thing is angiography, or also called as angiogram, is a procedure used to identify narrowing or blockages in the arteries in body. So these are the medical investigation you have to undergo to confirm the heart attack. Physiotherapy treatment for heart attack. Cardiac rehabilitation. Phase 1 is clinical phase, given in ICCU or ICU, which is generally a non-strenuous exercise. Passive movements to maintain range of motion and to achieve activities of daily livings. Second phase is outpatient cardiac rehabilitation, which generally starts when patient is marked out of danger by the cardiologist. In this phase, physio will improve the functional capabilities of patient by passive and assisted exercises. Third phase is post cardiac rehab or return to the home phase. In this phase, physio will focus on teaching some strengthening exercises and a few aerobic exercises to improve endurance and to prevent coronary artery disease in future. Medical treatment in heart attack. Anti-clotting medication are nothing but blood thinners. Medically they are called as anticoagulants. The name itself describes that it prevents clotting of blood in the arteries. Clot busting medication are also called as thrombolytics. The name itself describes that it basically helps in clearing up the already formed clots. Anti-arrhythmia medications. So this medication helps in calming down the abnormal rhythm of heart. Chest pain relievers for those who have the intense chest pain. supplementary oxygen for those who have the shortness of breath, feeling dizzy and lightheadedness. So these are some of the medical treatment prescribed in heart attack. Surgical treatment in heart attack. There are many surgical treatment or procedure carried out in heart attack depending on the patient's condition, but I'm going to describe two common procedures in this video. One is percutaneous coronary intervention, in short PCI. As you can see in the diagrammatic representation, this procedure is basically inserting a catheter based device into one of your major blood vessels, and once the catheter is inserted through a small incision and it reaches the blocked artery of your heart, the surgeon will inflate a small balloon on the end of the device to widen the blood vessel and clear the blockage. Second procedure, very common procedure, is coronary artery bypass grafting, in short CABG. As you can see in the diagrammatic representation, it's an open heart surgery. CABG procedure involves in taking a blood vessel from elsewhere in the body, usually from the chest or from the leg, and it will be used in constructing a detour for the blood to use. And this will reroute the blood supply around the blocked artery section. What to do if someone falls unconscious complaining chest pain and you think it's a heart attack? Number one, first of all, call 911 or your local emergency number. Secondly, until the emergency arrives, perform CPR on person. CPR is nothing but cardiopulmonary resuscitation. As shown in the picture, place your palm on the chest of the person, and if you're untrained, then recommended is 100 to 120 compressions per minute. Trained person can do 30 compressions per minute, that will be enough. And followed by 2 rescue breaths directly from mouth to mouth. And repeat until the emergency arrives. Before I end this video, let me give you 2 other names which is used in the cardiovascular disease other than heart attack. Is cardiac arrest, occurs when your heart stops beating due to an electrical malfunction. Unlike in the heart attack, it is due to the blockage of coronary artery. Another name in the cardiovascular disease is heart failure, occurs if enough of heart tissue has died, damaged, permanently damaged, then your heart is now weakened and can't pump the blood effectively, which can lead to heart failure. So that's bring to the end of this video, this topic. We'll meet in next another video. Until then, take care. Goodbye. Thank you. Follow me at YouTube, Facebook, Instagram, and for any business related enquiry, contact me at dr.abdul.pt@gmail.com.